Hello, my name is Reese. My group consists of Johnson, Ellisor, Lloyd, Ramey, Silva, and Williams. We conducted our program evaluation on Safe Haven. Safe Haven Community Services is a 501(c) nonprofit organization. They're located in Houston, Texas, and they service the Houston, Texas area and then also the greater Houston, Texas area. They work alongside with the Texas Department of Family and Protective Services, specifically in the Child Protective Services Division. And they're also funded by DFPS as well. So the organizational goals and objectives for Safe Haven, the main goal for Safe Haven Community Services is to provide a safe and nurturing environment for children until permanency is reached, whether that's going to be reunification, adoption, or extended living. The way that this is done, or the objectives of this goal, is by Safe Haven working within the community to license foster and adoptive homes. So that way children can be placed in these homes, which are regulated by the state of Texas. They all meet Texas minimum standards. And some of these homes are kinship homes, which means they're relative or they're unrelated homes. So the time that they're in these homes could vary. It could be from 1 to 3 months, and it could also be for a year until the parents work the service plan. Specifically, Safe Haven has a training program that addresses corporal punishment usage. And this program includes 3 trainings that are helpful in letting foster to adoptive parents know the consequences of corporal punishment and why it is not allowed. So one of these trainings are pride training, which is 16 hours, and it covers the developmental aspects of a child that has already been through a traumatizing event in their life, which is why they probably are in care right now. Trauma-informed care is an 8-hour course, and it lets foster to adoptive parents know that by using corporal punishment, trauma can be put on the child again. So that is also a negative effect of corporal punishment. And then there is PAPH or EDI training. And so that's an 8-hour training, and it covers restraint. So this is a training that is effective in helping foster to adoptive parents use another form of discipline besides using corporal punishment. So the research question for this study was basically, Safe Haven wants to know if the trainings that they're conducting right now, are they effective in expanding the foster parents' knowledge in alternative discipline methods? So they're wanting to see if the trainings that they're giving right now, is that enough, or are the parents retaining information that are given during these trainings?
Okay, so for the literature review, the Marie Vincent Foundation in Quebec completed a survey on 1,000 adults on their attitudes / their views on corporal punishment. The surveys hypothesized that non-severe spanking or corporal punishment would be viewed favorably among participants. The 2 sides to the argument were, does corporal punishment, is it detrimental to the health of children? And the other side is corporal punishment is used as necessary to deter children and gain control of negative behaviors. Disobedience was found to be the largest reasoning behind the use of corporal punishment. It was found also that older participants who were spanked as children were in favor of corporal punishment because they felt that it rarely led to physical injuries. Anger and frustration were found to be large factors for the use of corporal punishment, and the most punishment age grouping were children between the ages of 3 and 6. In the end, it was found that favorable attitudes were the pushing factor of the use of corporal punishment in disciplining children. This was more heavily the case over the mood of the caregiver, and less educated participants and older participants were more heavily in favor of physical punishment compared to other participants. In the end, we were trying to see if, based on the literature review, that if attitudes can be changed or modified through preventive programs and education, that this would possibly decrease the number of children experiencing corporal punishment and abuse, while also decreasing the community or society's tolerant attitudes toward corporal punishment. And our research question was, are the trainings effective in reducing the use of corporal punishment in safe haven licensed homes?
Shoot. Oh my god. Oh my god. Where is it? Okay. An exploratory evaluation was conducted of Safe Haven's current training programs. When we consider the purpose of the evaluation was to evaluate if the current training programs provided adequate information regarding alternative disciplinary measures in order to reduce the use of corporal punishments. The variables defined in the evaluation were the client's self-reported knowledge of alternative disciplinary methods and subsequent use of corporal punishment. Both qualitative and quantitative data was collected through an electronic survey. A non-probability design was implemented and a convenient sample was used. Foster parents from each of the 115 licensed homes were surveyed via email with the expectation that the response rate would be much smaller. The overall design of the evaluation was a pre-experimental design. This design was chosen to evaluate if the current training programs that are in place were effective in reducing corporal punishment and determining if there is a need to make changes to the current training programs in order to improve the safety and well-being of children in safe haven licensed homes.
All right, so we asked our participants to rate their knowledge of corporal punishment before and after the training. The results indicated that 62% of the participants were very knowledgeable on corporal punishment before the trainings, 25% had some knowledge, and 12% had no knowledge. After the trainings, there was an increase to 86% of participants who are very knowledgeable on corporal punishment. We also asked our participants to rate the knowledge of alternative discipline methods before and after the trainings. The results indicated that 70% of participants were very knowledgeable of alternative discipline methods. 29% had some knowledge. After the trainings, there was an increase to 87% of participants who are now very knowledgeable of alternative discipline methods. We asked if they believed corporal punishment is the most effective disciplinary tool in parenting. 95% of participants responded no. 79% of participants responded that corporal punishment is not a necessary tool for parenting. We also asked how often they incorporate corporal punishment as a disciplinary measure, and 100% of participants responded that they would never incorporate corporal punishment in parenting.
Okay, so the recommendations for this study basically translated that the results mean that the presented study supported the hypothesis through increasing knowledge, the knowledge of participants. However, incorporating preventive and also awareness strategies in the training help the individuals who are adopting basically these children into foster care, the knowledge to incorporate other alternative disciplinary methods. The presented study also revealed that caretakers are capable of implementing behavior solutions that are fit the child basically and ensure the safety of the child. However, by implementing these strategies, children basically it reduces the risk for children to experience or be exposed to child abuse or any other forms of neglect. The recommendations for this study, basically from concluding all of the information, Safe Haven can continue to implement a continuation of preventive strategies to parents, also and bring awareness through their training. Another recommendation would include incorporating ongoing training prior to the training that they have before placement. Also, another recommendation would include just in general incorporating training on a monthly or quarterly basis to basically refresh or to keep the parents up to date on new strategies and new methods that they can implement with the children. Also, to improve the functioning of the Safe Haven program, it is recommended that the agency address the lowest scores on the survey and indicate areas for improvement through a better form of development, and also implement different strategies that can be implemented to increase the numbers as far as knowledge of disciplinary methods. And so this would conclude our presentation. There's also infographics which discuss the corporal punishment training and how effective it was among the participants. Out of 24 participants, the results indicated that 20.83% of families feel that corporal punishment is somewhat necessary. 62.5% of participants were knowledgeable about corporal punishment. 79.17% of families are very likely to incorporate the skills and strategies from the training. And 87.5% of participants believe that after completing the training, that they were knowledgeable about alternative disciplinary methods. In conclusion, 3 out of 21 families are likely to recommend this Safe Haven training to others. And then this will be our reference. And thank you for listening to our presentation.